If we had another pandemic, would we do the same thing? Would it be completely different?
No.
Well, how would it be different?
We do science. We do evidence-based medicine. CDC knew how to do this, and WHO, they knew there were manuals on how to do it, but they just threw those manuals out of the window. We're going to do peer-reviewed, we're going to do placebo-controlled studies on all new medications and all new technologies. That's what we should have been doing all along.
That was the Health and Human Services Secretary back in May. Now, tonight, right before this show, the CDC director is no longer there, Susan Monarez. And the HHS secretary back in March defended her, at that time his nominee, saying ex posts that erroneously attribute Biden-era tweets supporting masks, lockdowns, vaccine mandates, etc. to my CDC Gov director nominee, Susan Monarez, have understandably provoked agita within the MAHA movement. I handpicked Susan for this job because she is a longtime champion of MAHA values and a caring, compassionate, brilliant microbiologist and a tech wizard who will reorient CDC toward public health and gold standard science. I'm so grateful to President Trump for making this appointment. Only a month in, she is now out, and that's not all. As the show has gone on, we've heard of more resignations. The National Center for Immunization and Respiratory Diseases, that head, if we can put his picture up, also the CDC medical officer has resigned at this hour, and the head of Zoonotic Division also resigning from CDC. So it is happening, and we're getting wire reports right now during the show saying that some of them are citing overstatement of risks of vaccines and the CDC budget cuts in resignation letters that are coming out. Let's bring in our panel. Tom Bevan, Real Clear Politics co-founder and president. Josh Kraushaar is a Fox News radio political analyst. And Yemisi Egbewale is a former chief of staff and advisor to the Biden White House press office. Tom, this seems like a clear out based on policy and maybe money.
Yeah, and there are rumors that there might be more coming, more resignations coming. And so, look, the other thing that happened, the FDA announced today their approval for vaccines, the guidelines, which then have to be, handled by the CDC as well. And so it clearly seems like there is a conflict within the CDC with the upper echelons there about what to do about the vaccines. The other thing that I would point out is that Susan Monarez in her confirmation hearing not too long ago said she didn't see that there was any sort of link between vaccines and autism, which is something that might put her at odds with the HHS.
Yeah, I mean, just yesterday we heard at the cabinet meeting, Josh, that HHS Secretary Kennedy said that they were going to come out with a big report in September about the linkages and causation of autism.
Yeah, look, the HHS has been one of the most tumultuous agencies, in part because Robert F. Kennedy, his MAHA movement, is politically incompatible with a lot of the civil servants who work at CDC. And you can see that the issue over approval of the coronavirus vaccine for kids has become another flashpoint in this debate. The Washington Post is reporting that Montanez went to Senator Cassidy, who has been something of a skeptic of Kennedy and was trying to hold his feet to the fire during during Kennedy's confirmation hearing. And Kennedy was very upset that she kind of did an end around his leadership. So that may be a political issue going forward. But look, MAHA and the civil servants that work at the CDC are not always aligned on policy, and this is coming out in the open right now.
I mean, we've seen fights like this before in different administrations. This is only a month into this CDC director in this job. Yemisi.
Yeah, and this is a huge hit to the secretary's leadership capabilities. I mean, he had an incredibly tough confirmation hearing, and we know that senators on both sides of the aisles have serious doubt on his leadership capabilities. And so this is a time where he's going to really have to steer the agencies that HHS oversees. I mean, we know there was a shooting outside of CDC just earlier this month. Morale is at an all-time low, and so he's really going to have to find some good direction here.
All right, let's talk about the takeover in Washington, D.C., the potential takeover in other places. Here's Mayor Bowser, surprising comments perhaps, on what's happening here.
We greatly appreciate the surge of officers that enhance what MPD has been able to do in this city. What we know is not working is a break in trust between police and community, especially with new federal partners in our community. We know having masked ICE agents in the community has not worked.
Okay, but let's listen to some residents here.
Navy Yard has kind of been a hot area before all the, additional security. It was a little dicey at times, especially at the later times in the hour. I would see fights break out whenever I was just walking home, but now it's a lot more quiet.
I welcome it, and I think it's a great idea. And I have noticed that they have been cleaning some of the graffiti off in some of the areas, like on the highways and that kind of stuff.
What about the fallout of all this, Tom?
Well, we just had a poll come out yesterday, the AP polls. 81% of people think that crime is a problem in major problem in urban areas. Trump's approval rating on crime was 54% in that poll. In the Harvard-Harris poll, it was 51%, his highest rating of any of the issues that they questioned voters about. So I think what you saw from the mayor, which she said is a bit surprising, I think that's her responding to her constituents. She's hearing from people who are saying that, especially in the areas where crime is the worst, that they feel safer. And that's not a bad thing. Democrats have managed to box themselves in on another 80-20 issue and are trying to find a way out. And I think the mayor has recognized that, and she's obviously in the middle of it.
Josh, that AP poll, we referenced it on the big board, the 81% is a major problem, minor problem, 18%, 1% not a problem. And then you look at the other poll in there about federal interventions in large cities. We could put that up. And basically people they think it's okay to have military and National Guard assist local police, but not take control. They like the local departments.
Yeah, what's interesting is that Mayor Bowser is actually a tough on crime moderate compared to the city council in Washington, D.C. that went so far to the left on the issue of crime that even Joe Biden's administration basically rebuked the city and did similar interventions in preventing a law from getting passed that would actually reduce penalties for criminals. Look, I think the sweet spot is helping law enforcement do their jobs, having more money, having more police in the city. Mayor Bowser also did say she was against the militarization of police, having ICE doing immigration enforcement. That's going to be a tough sell, not just in the nation's capital, but perhaps beyond the nation's capital.
Demetra Daskalakis, an official at the Centers for Disease Control and Prevention, CDC, resigned this week, claiming the Trump administration's policies ignore science. However, his own leadership during the Biden-era monkeypox response was criticized for putting optics over public health. Amid the Trump administration's efforts to push out CDC Director Susan Monares, a handful of other top CDC officials, including Daskalakis, resigned in protest of the Trump administration's policies. Daskalakis wrote in his resignation letter that was posted to social media that the health policies put forward by Secretary Robert F. Kennedy do not reflect scientific reality. He also accused the Trump administration of attempting to erase transgender populations, while also using the term pregnant people to describe women who are about to give birth. But flashback to 2022 and 2023, after the monkeypox virus had spread across several countries and made its way into the U.S., during which Daskalakis was among the Biden administration's top advisors who spearheaded the national response to the disease outbreak. Government communications from that time period, uncovered by watchdog group The Oversight Project, show that officials were aware that the disease was spreading among the gay community. However, those communications and other records show the administration appeared to be more concerned with protecting the stigma targeting the gay community than they were with implementing measures that would provide the best mitigation response. A common theme was public health officials identifying locations where outbreaks occurred, to include bathhouses and saunas, according to the Oversight Project. Officials never broached consideration of shutting down these locations. This draws a stark contrast to the public health guidance and shutdowns of gathering places during COVID, to include gyms and skate parks. In 2023, after the monkeypox outbreak had taken hold in the U.S., Daskalakis went on national television to let the country know that his team was making sure they got the word out in a way that supports people's joy, as opposed to calling them risky. You know, one person's idea of risk is another person's idea of a great festival, or Friday night for that matter. So, we have to sort of embrace that with joy and make sure that folks know how to keep themselves safe, the Biden monkeypox coordinator added. Meanwhile, during the outbreak, Daskalakis posted a tweet from gay sex app Grindr that stated, "Dr. Daskalakis could jab me any day," with a sticker of a flattered cat. In other social media posts from around the same time, Daskalakis can be seen using male models wearing leather bondage straps to make an entrance at an HIV prevention summit. While in his role at the White House leading the monkeypox response, Daskalakis also reportedly ran an STD screening operation from an after-hours sex club in New York City. When asked about the operation in an interview, Daskalakis described it as exciting and added there was not much sleep time. Later in the interview, he added, "I'd already kind of been the bathhouse HIV testing doctor." Fox News Digital reached out to Daskalakis about the juxtaposition between his criticism of Kennedy's policies not reflecting scientific reality and his role in the Biden administration's approach to monkeypox, but did not receive an immediate response.